Well, you know, stress isn't good for you. The effects on our bodies, though, may not be so obvious, but the harm is critical. Dr. Siegel, we all know how bad we feel when we get stressed out, but how bad is it?
Well, you know, it's a long-term problem. There can be good stress that gets you motivated, but there's a bad stress over a long period of time. And from a medical point of view, we look at it in terms of hormones. A couple of bad ones: cortisol, which is a steroid that your body makes, adrenaline, over a long period of time. And they did a study of 17,000 adults, Eric, who when they were kids, the Center for Disease Control, when they were kids, they were exposed to some kind of emotional trauma or stress or abuse. And then they followed them over the course of several years. They found out they had a higher risk of depression, a higher risk of lung disease, a higher risk of alcoholism, a higher risk of heart disease. This was a huge landmark study, and it makes the point that over a period of time, stress wears down your body. We know that stress raises your blood pressure, stress can make you gain weight, stress causes you to be inactive. All of that leads to heart disease.
When nothing else seems to help, imagine what it would be like if your doctor or surgeon said, "Let's treat this by addressing your emotions." Now let's meet such a doctor and surgeon and see what he's been doing when addressing chronic physical ailments.
I'm a urologist, and I've been incorporating mind-body healing techniques in my practice for 20 years now. I became considered a regional expert in chronic pain and chronic pelvic pain for Kaiser, where I work. The medical group that I work for has 12 or 13 med centers and 2 or 3 million members. It's a big group. What I didn't know is that the chief of my department went to this regional meeting, and they had all the chiefs from all the different medical centers, and he said, "You got to see this Robbins guy. Send him your worst patients, the ones that no one else has been able to help, the ones that have been to 2 to 15 different physicians and they can't help, the ones that are emailing you every day because they're not getting better, the ones that are going to kill themselves, they don't get better, send them to him." And that literally is what happened overnight. Once every week or two, I'll get somebody who says, you know, if I can't help them, they're going to kill themselves. It's been all faster EFT skills, and we've really been blessed to put it to the test with some really, really difficult cases. You know, and I always say, if you can clear emotional issues at a deep enough level to get a physiologic shift and physical healing, then the other stuff is a piece of cake.